Hello, everybody. Good evening. This is Dr. Welcome to you all as I embark on the second day on my take on the myths I have seen in on the myths in healthcare, right? And we were talking about some of that yesterday, but I was just presenting, I was just uh, making it available for people. And we'll go a little deeper today as to what are the consequences of this and why, with so much knowledge, so much technology, so much scientific breakthroughs, we have the healthcare consuming a lot of dollars and also really not helping the quality of life. You know, from my perspective, when I see patients in the hospital, nursing homes, and the clinics, the same story, right? Um, Lots of times they just get disabled after uh, getting seriously ill, acute conditions or chronic conditions, and then they can't return back to the life that they had with vigor and energy that they need to. So it's kind of a serious thing for me, and that's why I looked at it very closely. Obviously, practicing in the field for 4 decades or more, you get to see a lot of changes. You get to see a lot of practices that we don't agree with. And when we started, at least people were really enthusiastic about helping patients and really getting a lot of joy out of it. And that is being interfered by this revenue occupation, domination, right? Um, Most of the hospitals, most of them are revenue driven. So the goal is bottom line, how much money and all that, right? They may say so many other things, but that's exactly what it is. Even when we were implementing EMRs to improve the patient care, uh, that petered down to so many billions, 86 billion, I think. They were given to a lot of places just because they are keeping up the numbers. Just like an accountant cooks up, certain percentage of quality measures are given, because I was from the beginning, I participated in the meaningful use thing where it started from the beginning. I was having a friend in the central government there, and they kind of invited me to participate in certain things. So from the time of conception, I was there. I was active participant as well. And then I was very enthusiastic in my local level. At the hospital, I was leading the movement and all that. And I was so naive. I thought they would really insist on hospitals meeting the 100% goal of the meaningful use measures, right? And then it was come down to 30%, 40%, and others also just adjust a couple of them. Simple things like everybody who comes in should have a temperature check and blood pressure and smoking, simple things like that. Even for that, they were not 100% of, that means 100 patients came and they are not able to check on the simple things and then document them and make sure that they have given the smoking education and all that. So anyway, that's a complicated matter. But then the point was, we spent a lot of money bringing in real good technology, but then we kind of made it like a commercial thing because it was open source that could have been installed and then could have helped us with healthcare a lot. But then they gave it to private people who have designed according to their computer sciences and all that. So uh, implementing the EMRs was also became a money affair, right? So we were disappointed. I was really deluded because I thought this is one place where the technology can really help the patients to get their records quicker, legible, and also interact with so many divisions of medicine and all that. Anyway, uh, well, that's a delusion. That technological prowess, properly implemented, can increase the patient care. I was deluded, so maybe I was too naive to believe that. Uh, but what I want to talk today is about some of these myths are so prevalent, so much believed by people. People don't take real serious responsibility for their own health. For example, you are supposed to pay your taxes, you are supposed to pay your bills for the grocery and whatever. So you are very responsible with your paycheck, right? And my viewpoint is you should have an idea about what kind of things you can lose, and in the ultimate analysis, how that is going to be a much bigger investment to be aware of your health and take care of it appropriately at the right time. And also, meanwhile, have a healthy lifestyle. Don't be influenced by alcohol companies asking you to drink, or cigarette companies asking to smoke, or movies and sports wanting to sit down. They are playing, but you are sitting down. Or all the food industry promoting all sorts of junk to go into us, right? Uh, so people don't take these things uh, as serious as they should. Not that they should be really mortified or fearful. But what I'm saying is just take it as it is, and then consider the advice that government, other people bring out, saying that this pyramid is for the good health, and then they revise them too because they are not standing firmly on one thing. They are revising them. So some of it is good, but then beyond that also, there is so many ways common sense people pick up from the other cultures, other civilizations, or Esther times, or real good best practices that are practiced in very healthy institutions. They are there. But then that's not seeping to everybody. That's my concern, right? So when you really are kind of altruistic about this, and want everybody to be healthy and wellness, it is very evident that people think, oh, I have insurance, so I have very good insurance, they will cover it. When you go there, they say, okay, where is your deductible? Where is your copay? Where is your percentage of copay? Or, all those things. They have to. So, insurance companies will care for our healthcare is the biggest myth in this country. So that's something you want to pay attention to, right? So I talked a lot about that yesterday, but then if you go to the second one, it's like um, see, individuals think that healthcare industry, that means all the hospitals, clinics, and health policies, government, everything, uh, they are responsible for our health. They are there to provide service, but they are not responsible. We are responsible at individual level for our health. That's another big myth goes around, because it's not like a communistic thing, but it's more like a if I get sick, I go to the hospital, they should fix me. Whether they know, this came out in the COVID, right? Everybody thought, oh, these people should have ready for this and fix it, as though we kind of predicted it, And also, it's a novel virus. So that means it's a new virus. It doesn't have any immunity. And so we are all susceptible for that. And on the top of it, we don't live a lifestyle that is conducive to have some resistance or inner resilience to the new bugs, right? And we also, as people don't take responsibility of how these bugs are coming on, how we are making an atmosphere where excessive travel and no real real controls of people spreading this virus whenever they can, right? So let me reduce this volume maybe a little bit. Okay, so that is there. Okay, um, so when that virus broke through, nobody really claimed that this is the origin, this is where it has happened. So we better uh, restrict them. That used to be the case. Wherever, whichever small village these viruses or bacteria, whatever harmful for us, broke through, that was picked up by the epidemiological branch of the WHO, and then immediately people were sent, or everything is arrested to that particular village, right? And that kind of institute was taken off by the administration at the time, because they thought they're unnecessarily paying that institution more money. Okay, so that kind of thing. So institutions, and although they strive, they do research, they do scientific testing, and also really making sure that they're all safe and all that, right? And there's so much improvement on that, right? Ever since HIV, so many things have happened for the immunological branch, actually. So we know much more about human immunity and how we can improve that. But the knowledge we have and the things we are implementing as a public is very, very wide, because people, it doesn't seep through everybody, and then it is not practiced all the time, right? Even food industry, they don't do them unless they have some penalties for really doing some of those. So if you take a vast picture, the the industry, the governments, they all work. But then, like anything else, right? So suppose there is a problem with a democracy is going down, we take active role and make sure that we support the people who are democratically elected, right? Not the party, just democratically elected. But otherwise, we'll have to be aware, and we have to go and express our opinion, all that. The same thing is much more so in the healthcare industry. I believe that many people are really not awake to the things that are going on in the healthcare field. For example, if you go to a hospital, uh, they do all sorts of things, and they rack up the bill and all that, right? Uh, then you have to be aware of this. Suppose you are flown somewhere, then they charge you several thousands of dollars. I myself saw when I had the stroke. I went to our hospital, my own emergency room and all that, and they did the initial things, and afterward they had nothing else to do. But because I'm a physician and I'm known here, they kind of flew me in a helicopter to the University of Iowa. And then later on, a couple of months later, I got better in a month that came out and all that, right? I got a $50,000 bill for that flight, which took only 20 minutes from here to Iowa, University of Iowa. And I never asked for it. I didn't even need it. They didn't do anything for me. They just sent me a couple of days later to the rehab near my home. So if they could do something like that to me, a physician, you can imagine. This was there, this charging thousands of dollars for the helicopter rides is there in the system. Okay, so this also, again, if you are not aware of it, these things are going on. You don't know how to fight also about that. But I found out, and I talked to my administration, and then they kind of reduced to several thousands, I think, 5,000 or something, which are paid, I think. But the thing is, they will do all sorts of things like that. Okay, so expecting the healthcare industry completely responsible for health is a myth. It's not like a communist country. It's not like a altruistic country. It takes money to get good care too, so that is there. But you can help yourself to be well and go to the healthcare industry only when you really need it. That's the best way to save money, save your quality of life and all that. And we talked about healthcare insurance companies and healthcare industry. Now, other belief that people have is, oh, we have a magic bullet for everything. All we have to do is when we are sick, we can go to a facility and then they will give us a magic bullet. And then, irrespective of what kind of disease it is, what kind of things you may have that are beyond any capability of treatments of the industry, right? So we still don't know a lot of things completely, right? We are trying hard all the time as research people and all that. So that's another one, third one. And then uh, this is a myth I talked about earlier too, that we think our healthcare providers are taking care of themselves well. That's a myth. Many of the healthcare providers, doctors, nurses, well, they are really leaving the field. They're really burning out. I see them, right? And then they're demoralized. And then the glamour, the status, the money that was there before is not there anymore. Now it's a harassment and more work and less satisfaction, no respect, and all those things are going on. And we are threatened with a threat down the line, pretty soon probably, that many doctors will leave the field and then it will be a national emergency that way. I think there is some uh, truth in that concern. And but then this AI development has changed that quite a bit. Doctors will be obsolete in the traditional roles. There will be more advanced technology for the laser surgery, for the remote monitoring, for so many things. We can use the AI much better, which I am doing right now. Okay, I can communicate with anybody. I can really produce a real good treatments through the help of the search. So a lot of good things are happening because of the AI. But at the same time, people will lose jobs. Doctors will be one of them. Right? Their jobs will be obsolete. That's what it is. Anyway, doctors are uh, really demoralized, burnt out, stressed out, and not really getting the same um, respect, same kind of enjoyment in the profession. That's too bad. Okay, I myself, I'm very happy to treat people and to really be useful for them. And I made this a spiritual practice. Okay, seva. That means service. Okay, I provide service, so I don't. Really resent that. Actually, I like that. I enjoy that. So for me, it's a chance that I'm able to help somebody. Okay, that's significant, right? And then uh, the other big deal is people think all these alternate medical treatments that evolved in the past are they're continuing or evolving now. They think unless they are scientifically branded or wrote in some journal or evidence is shown, they don't want to accept that, which is fine, safe, and all that. But then there are thousands of years of wisdom that went into the healing systems. And you could be led completely wrong in people who don't really know about them. But if you go to an authentic practitioner of yoga, for example, authentic practitioner of Ayurveda, then you will be getting a very unselfish needed care through that kind of system, right? I myself developed immense benefit from yoga system, and then also it started as physical for me, like everybody else. But then I moved on to breathing, I moved on to mind control, I moved on to really being involved in the Advaita philosophy and oneness philosophy, right? Um, but then there is this false belief in the society and the system, everywhere else is that lot of good systems that are sacrificed because of this myth that anything that's not science, or they think according to their scientific way, then that is bad. But then the other people also may be seeking truth, maybe doing experiments and all that, but then they don't have the same kind of standards like here. But that doesn't mean the knowledge, especially if you read like I did read, like investigate like I did, you will find a lot of value in the ancient health systems. It's not like a I believe or I'm religious about it, not at all. It's a quest for the truth. They also did that, and not being a hurry about fame and name and all that. So if you can find the authentic practitioners of any of these Chinese, Indian, European, or Egyptian, or Indian, these some of the systems are very, very, very healthy. Okay, but there is a myth that there's a lot of bunk and only we are right. No, so we talked about that too. So now, if you can really go into the real things that we do, what is the approach we can develop after understanding these myths, and then really going deep into them and finding out whether it's real or not. I would encourage everybody to do that. Then you can change your approach from just confining your house and among the technology. Go to the nature, live close to the nature. That's what the ancients did. Then pay attention to your nutrition. Should be vital and good, organic, not infested and all. And then do some stretching with a deep breathing on a daily basis. Improve the quality of your sleep. But so many things are there. And then how to manage your mind, understand that and practice that, not just understanding and then subjecting yourself to a lot of data, lot of things coming at us, right? And then of course hydration is a simple thing, you got to do that every day. And then being kind and helpful, that's also important. And then what I preach nowadays is called proactive wellness. That means you don't want to wait for the diseases to come to you, but then you can start with looking at what is going on with you. If you have underlying condition, then you aggressively take care of it. If you don't have it, go and check for it before it comes on to you, right? That way you can prevent a lot of illnesses. That is a proactive wellness where you take initiative to go and check uh, all the panels and everything and discover, not in a being afraid and all that, but more like a insurance, right? I don't want to get laid down suddenly and all that. Lots of times you can prevent a lot of things if you catch them very early. Diabetes, high blood pressure, anxiety, any of those things. Infection also, you can get a lot of resilience. So the infection will not come to you. Even if you come, you have a resilience to fight it off. Okay, that kind of. So this proactive wellness is very much going to be in vogue because a lot of people are taking supplements. A lot of people are checking their profiles in a profound way, and then they kind of accept these pillars of wellness and they practice them. Their workspace is also praising and allowing those things. So that kind of attention will eventually help you to live proactive wellness. Okay, and down the line with the genome therapy, with a microbiome, all those things we understand, who can give you uh, a plan that if you can implement in the next 10 years, you won't be reflecting those diseases. For example, diabetes, you certainly can diagnose very early. They call it pre-diabetic, where the blood sugars are really high, triglycerides are high, cholesterol are high, but then HDL low. That kind of thing they can see. Your family history and all that. Then they'll do exercise, diet, and exercise, that kind of thing. Really good. Okay, so think of that term, proactive wellness. That means wellness we kind of embrace and we want to have that in our life, right? That is proactive wellness. Before the disease symptoms come, before the disease really manifests into some kind of syndrome in you, you kind of go to the doctor, get checked out everything, and then you can prevent those things. Like a uh, mammogram we talked about for the breast cancer, right? But then we come to know that's not a big deal. We can really see the cancer very early and provide treatment, whatever it is, chemo, radiation, or surgery, whatever we can. If you give them very early, they have less chance of manifesting the disease. Okay, you can have disease, but you don't have to really manifest that into a disease, right? That kind of thing is going to be very much in vogue in another 5-10 years, where you are not going to go to a preventive exam. You are going to go and see what is the diagnosis down the line, and how can I prevent that by my lifestyles now, or whatever you are doing that is wrong, right? That kind of thing. So I very passionate about wellness because I have seen so many people came late in their disease in India and here also in United States. But I didn't practice in India as such, but I kind of more like a practice only here. So a lot of people they wait till the last moment sometimes and then they come, because the health is the last that people do. That's something is not right. So if you are well and if you are energetic, if you are really happy, that's good. But most of the people don't hope for all that. They just hope, I don't want to have any problem with this. Is I just want to repair and then be happy for a while. It doesn't happen like that. It involves a lot of work on your part to make yourself like that, right? So you get to really be responsible for your health, and then use all the breakthroughs that happen, both in modern science and also ancient wisdom, combining it. Then you are not only be productive in your life and in your relationships and all that, but you also will be very uh, happy because you are living a certain lifestyle that is conducive to uh, continuous energy, joy, and happiness. Okay, so I think I did say what I need to say, um, but there are so much more on each one if you explore. Uh, so think about those myths and see any of the myths that you have come across. And then one thing is, health as defined in modern terms is not accurate. Okay, it's not enough that you are symptom free and then you have uh, chronic diseases breeding underneath. Do you know that your cholesterol starts to rise and accumulate in the blood at the age of 20? So I used to put a slide in my clinic, the longitude section of an artery, where you can see between the walls you have the fat and all that, and how it pumps a small thing in the interior of the vessel and all that, right? Then we can show from 20 years it slowly raises the peak of that and then causes into a plaque, and then when it ruptures you have heart attack, right? So that is we know about it. So nowadays we check a lot more than before, and then sometimes you can catch something that's not really relevant. But if you have a family history, you have a lifestyle that is confused, and then we do these things, then we put all that together, then you say you have this much chance of having this manifest in 10 years like that. And lots of times it has become very common to see people who have cholesterol high, blood sugar high, kidney function is bad. Uh, they're having problem moving their joints because they have a lot of stiffness and all that, and so arthritis, heart failure, diabetes, cholesterol, all these things happen to many people, and as they are having for a long time, they will have complications from the long-term illness. And then with this COVID, those people are affected very much. So that's why, as you age, you need to do more exercise. Less of the stressful things that you do. Okay, you have to build that up into resilience. Even young people are not having resilience these days because they have this attention deficit, right? So they don't have that, and then so they are dying much younger now with heart attack than before. Okay, I think we all know this, right? So be aware, pay attention, discover problems much earlier than you could anticipate, and then take a proactive actions to really resolve these diseases in you. Okay. Hopefully, I made some sense to you guys, and I will see you back tomorrow, and we'll talk about a little bit more on the other side of this kind of thing, and then why I go into wellness, why I promote wellness, why I'm like a chief wellness officer. I'm doing those things in my company, and for myself, for my family, and for the people who listen to me. This is very difficult to find people who wants to understand at this level, right? So that's something we hope will change, and then more people will listen, and then take intelligent action by themselves. Okay. So, anybody has any questions or comments or anything that you want to ask me, then you can come up, and I'll be happy to engage with you. Um, this is actually the understanding the health system, understanding the drawbacks of it, understanding where else in the world that have better systems, and bringing them all together so that people will be helped really, right? The transformation or that they are seeking will be, manifested, and they are happy about that. Okay. All right, then I spoke for maybe 30 minutes. Yeah, maybe. I don't know. I think we started early, so that's all right. So I take this very serious. That's why I'm coming on and talking about this. If you have any questions, send me DM, or I'll see you back tomorrow. Bye bye.